हेलो गुड मॉर्निंग माई सेल्फ डॉक्टर आर्यन। और आज हम डिस्कस करेंगे मेडिसिन के प्रीवियस ईयर क्वेश्चन पेपर। अ पेशेंट प्रेजेंट टू द ER with anaphylaxis. Which of the following not a part of the clinical criteria to diagnose anaphylaxis? First, urticaria, edema of the lips and tongue and rashes within 2 minutes to 2 hours of contact. Second, wheeze and respiratory distress. Third, abdominal cramps and vomiting. Fourth is a hypertension. Right answer 1, 2, 3, 1 and 2, 2 and 3, and 3 and 4. The right answer is 3 and 4. Here the abdominal cramps and vomiting, and here the hypertension. Anaphylaxis is severely potentially life-threatening allergic reaction that typically occurs rapidly and involves multi-organ system. Although in the rare cases of hypertension, anaphylaxis exit the typical cardiovascular manifestation of anaphylaxis is a hypotension due to vasodilation and fluid is shifted from the intravascular space to extravascular space. Abdominal cramps and vomiting are not common associated with anaphylaxis. Next question. Which of the following is not a complication of blood transfusion in a 25-year-old mother who developed acute postpartum hemorrhage, hypovolemic shock, and underwent major blood transfusion after delivering a baby boy? Hypocalcemia, hypokalemia, hypothermia, and hyperkalemia. The correct answer is hypokalemia, because the hypokalemia is not seen with blood transfusion. Instead of hyperkalemia occurs. Instead, the hypokalemia is occur the hyperkalemia due to the leakage of potassium from red blood cells in stored blood due to the leakage of RBC. Next question. What is the lifelong treatment for individuals who have received a potent prosthetic mitral valve replacement? The correct option is warfarin. All mechanical valves require long-term anticoagulation because they can occur systematic thromboembolism or may develop valve thrombosis or obstruction. Warfarin helps to prevent thrombogenic events or activity by inhibiting the clotting protein in the blood, and aspirin acts on blood platelet. Only warfarin instead inhibit the circulating blood clotting protein in the blood. Clopidogrel also has an antiplatelet action like aspirin. Both these drugs act on platelet and not on clotting proteins. Atorvastatin is an anti-dyslipidemic drug. Patients with prosthetic valve requirement require regular intake of anticoagulation more than a anti-dyslipidemia. Next question. A farmer has come with symptoms of pinpoint pupils, excessive salivation, and increased secretion from the body. The most probable diagnosis is organophosphate poisoning. Meiosis, pupil, or pinpoint pupil, increased salivation, and body secretion are characteristics clinical feature of organophosphate poisoning. And in opioid overdose, patient may have present a pinpoint pupil, but they may not have the features of the increased salivation or body secretion. In the stroke, pinpoint pupil are present, but this essential does not mean the patient had a stroke. Moreover, the patient may present with other neurological symptoms instead of the increased body fluid secretion. And the heat stroke, the patient suffer from extreme dehydration in heat stroke instead of increased salivation. Here the patient suffer from the extreme dehydration. Next question. What is the optimal temperature for the water bath recommended for a patient with frostbite? Here the correct option is 42 degrees Celsius. When managing frostbite, one of the primary goals is to deworm the affected tissue gradually. The recommended temperature for a water bath in the treatment of the frostbite is typically set at 42 to 44 degrees Celsius in the Fahrenheit 104 to 107.6 degree Fahrenheit. This temperature helps to promote vasodilation and improve the blood flow to the affected area, aiding in the rewarming process. Promote two-way vasodilation and improve blood flow to the affected area. Next question. All of the following is used in the management of breathlessness patient at a high altitude of 1000 mts and accept intravenous decoxy, oxygen supplementation, immediate descent, stagiolomania. Here the correct answer is intravenous decoxy, because the above clinical scenario is diagnosed with the high altitude pulmonary edema. High altitude pulmonary edema. Intravenous IV digoxin is used to the treatment of heart condition, particularly the treatment of heart failure and certain arrhythmias. And the oxygen supplementation is a crucial intervention for managing a high altitude breathlessness, and immediate descent to a lower altitude is the most effective treatment for the altitude sickness in the lower altitude. The lower altitude is the immediate descent, and the stagiolomide is a medication that helps to prevent and treat altitude sickness. Treat altitude sickness. Next question. During a scorching summer afternoon, a man who had been toiling in a field unexpectedly collapsed. Upon examination, there were no apparent physical indication of dehydration. Although his radial pulse was detectable, the doctor determined that the man's serum electrolyte levels were within the normal range. Shockingly, the man's body temperature measured 106 degree Fahrenheit. Considering these circumstances, which of the following should be administered as an initial form of immediate assistance? Inject epinephrine immediately, cover with a hot damp sheet, cover with cool damp sheet, and start CPR. Here the patient is suffering from the heat stroke. So the answer is the gives the cover with the cool damp sheet. There are no sign of the dehydration at the body temperature to quite high and radial pulse is present or not. The next best system is to cover the a cool damp sheet. In the epinephrine inject can be the fatal for the patient. Cool and not hot damp cloth is used to the cool the body down. Cool the body down. CPR is not required as a study radial pulse is perceived and the patient is not in shock. Thank you and keep revising.